Hey guys, welcome back to another episode of The Chamber Guy. This is part 2 of our chat with Mr. Lim, who is the president of the Malaysian Association of Pharmaceutical Suppliers. Mr. Lim, thank you for joining us.
Thank you for the continuation.
Thank you. Now, just before we left, in part 1, you spoke a little bit about your background as well as a little bit about the association as well. And we touched on COVID-19, how COVID-19 actually affected the medical supply business in Malaysia. Now, Mr. Lim, from your opinion, what are the prospects of pharmaceutical supply business in Malaysia? And what trends do you actually foresee in the future of pharmaceutical business?
Thank you. It's a very relevant question. During the pandemic and the MCOs, as I mentioned earlier, much restrictions were imposed on the whole country. The pharmaceutical supply business is one of the few sectors allowed some liberty to continue operations. Hence, the losses, if any, was not as great as some other industries. Imagine not having any income for 2 years. That would be a big blow to any company. However, since we could, we had a rather stable industry where in good times or bad, we have a higher degree of resilience in continuity. But there, we do have to manage the situation, although we are allowed to continue, but some management has to be done. The components of pharmaceutical supply business are in the areas of sourcing, supply chain management, customer satisfaction, and what we call the acronym QSE, that is quality, safety, and efficacy of medicines. Entry into the pharmaceutical supply chain requires high levels of capital and expertise and a lot of patience. Every now and then, the world reacts to events, and this impacts policies which require adaptations. In the area of sourcing, the world, at least for MAPS, the world is our source. Our members source our imports from as far as Japan to the US. However, that presents challenges in meeting the QSE expectations of the NPRA mandated requirements for registration. But if we can meet all the expectations, we will have good prospects. Just to give you where certain conflicts may occur. For example, when we talk about PICS, which is the Pharmaceutical Inspection Corporation Scheme, usually these countries are Western countries, but in those countries, they don't actually need what we call Zone 4B stability studies, which means the temperature is at 30 degrees with 80% relative humidity. So they can meet the GMP standards, but they don't actually want to do a study on whether it is stable at such conditions because it's not relevant for them. So it presents with us two aspects. We can meet one, but we cannot meet the other. So supply chain in respect of MAPS members are at 2 levels. We're talking about the external, that is on the sourcing level, as well as the internal chains, which is how we supply to our customers. So the external chain is basically international cross-border movements of goods. Some of our members have their own supply chain set up for the local, while some other companies choose to outsource the local chain to another company. And for that case, they focus on sales and marketing side of generating demand. Since the reopening of the economy, the pharmaceutical business has experienced a strong upsurge. I have members reporting sales which are like 20% growth, or profits like 30% growth. And this is possibly due to pent-up demands. As I mentioned earlier, there were some patients who were lost to follow-up or they deferred the treatments. So there is these sudden pent-up demands being met. Lessons learned from the pandemic and the handling of it opens up many new possibilities for the pharmaceutical supply business. We saw a period of drastic shortages since the reopening of the economy. There has been a tapering of shortages, but there are still some shortages nevertheless. There are opportunities to source new products to meet this hunger for supply. With the healthcare costs expected to rise and the challenges in supply chain, not only in Malaysia but globally as well, there will be a pressure on adequate supply of good quality raw materials and finished products, cost pressure, timely delivery, etc., which is important to ensure that Malaysia has many friendly sources of procurements. Even local manufacturers are highly dependent on the global supply chain too, because most of the raw material are imported. Members of MAPS, due to their wide global network, are able to source for many products that neither local manufacturers nor the big pharma companies could source. For example, orphan drugs, low value but essential drugs, which some companies deem as not viable commercially. MAPS members are also able to import medications at lower costs, as many of our suppliers have the economies of scale not achievable locally. This ensures the competitive medicine prices are achieved and helps the government and patients to save costs. The government must and does, in our experience, recognize the role of MAPS as an important component in the country's strategic supply chain. We are fast moving into an aging population. With this, inevitably, the average cost of healthcare will increase. The elderly population trends towards multiple morbidities at a time when their active incomes are halted. So there's a double whammy here. Hence, the need for affordable generics plays a tremendous role in meeting the disease management of this aging population. The generic market is expected to expand as the government encourages the use of good quality generics. It is also a strategic industry when health, as evidenced by the recent COVID-19 situation, where major traditional exporter countries restrict exports. Malaysia was also affected, as I've mentioned. However, due to the collaborative partnership between government, private partnership, Malaysia was able to manage the supply adequately. We also anticipate, due to the vaccines, biosimilars will also be expected to make market entry. With all these factors coming together, the prospects for pharmaceutical supply business seems very bright in Malaysia. However, the country needs to have a master plan for the healthcare and pharmaceutical industry, and we hope that with the new government, there's a lot more engagement to achieving this master plan. Thank you.
Agree with you 100%. There needs to be a framework that is in place that will bring in more business. Now, what are the uncertainties in the business of pharmaceutical supply? Given the state the world is in right now with the existing geopolitical tensions, inflation, impending recession, and so on, does the association have any contingency plans in place to support its members?
Thank you. Well, recession is something that comes and goes. The pharmaceutical industry is not immune, but we are kind of a little better at surviving recession, because no matter what, people still need to be healthy, need to be medicated. Okay, uncertainty is now a norm in the foreseeable future. From the beginning of the pandemic leading into the geopolitical tensions, there seems to be no break between the one crisis to another. There have been many uncertainties. A large part of this is in the supply chain and imported inflation, since we are vulnerable to foreign exchange fluctuations. The supply of pharmaceuticals in the upstream sector is subject to a lot of controls. Any hiccup at this level will cause a domino effect down the supply chain. If I can't bring in my product, you can't have your product.
Yeah.
In the production of pharmaceuticals, we do not only have raw material issues, but in addition, there are also other things like excipient and finishing materials. Suppose even if the supplying factory can manufacture a product, the product is not considered complete until it is finally packaged in a form that complies with all the labeling and packaging requirements set by the authorities. So some of the sources we require are not unique to pharmaceutical industry. Example, I need aluminum foils to finish the packaging. But the demand for this material cuts across industries. So there is a shortage, for example, in aluminum. Since every industry is trying to catch up with the reigniting of the economy, that resulted in demand outstripping supply. That led to delays in production and also cost inflation because we have to fight for the same amount of raw material. Let me break down the problem with raw materials, that is the active pharmaceutical ingredients. In short, we call it APIs. The largest producers of APIs are China and India. In fact, a report by Gibson states that roughly 80% of ingredients in US, which is the most advanced country in terms of medications, 80% of the medications are sourced from APIs manufactured in India and China. It was only recently that China relaxed their COVID-0 policy. During the height of the COVID-0 policy, a lot of ports were closed, a lot of factories were not allowed to operate or operated at minimum capacity. So even right now, with the reopening, China, some manufacturers are wondering how to cope with the relaxation. Perhaps infections will go up. So there may be a fear of resurgence of cases, and this may again lead back to a closing down of production. The supply of API remains an issue as this is the key ingredient in the products. And another thing which the world may not know is that there is a recent worry about something called nitrosamines, which is a contaminant in some APIs. And this has triggered some products to be recalled from the market. And companies had to make risk assessments before continuing. We have seen this for ranitidine, which has been a mainstay for the gastric market. Some antihypertensives, as well as diabetic drugs like metformin. Collectively, these drugs are used by a sizable segments of our population. Then there is the clamor for port cargo containers. A cargo container can be used to ship any product, be it potato chips or integrated circuit microchips. So pharmaceutical suppliers who need to book shipments have to compete with suppliers of everything under the sun. That shortage caused many necessary pharmaceutical raw material and finished goods to be held up due to difficulties in booking the containers. It is good business for the cargo business. I think you could have heard that a shipping giant gave up to 52 months bonus recently. Yeah. Good and reliable partnership within and without the country must be forged, built, and enhanced. It is essential to ensure mutual trust among all stakeholders in the industry. Policy must be inclusive of all key stakeholders. It must not be short-sighted, where the government ignores the roles of local importers such as MAPs. Fortunately, the government has not done that. Malaysia is too small a market to be self-dependent with about 30 million population. We just don't have the economies of scale. And we also lack some expertise in R&D as well as the range of raw materials have to still be imported. MAPS members are well aware of the roles they contribute to the country, their network and agility in sourcing. As I said, we are not limited to one country where the world is our oyster. Has been proven many times in making the supply viable. We are exposed as well to make annual overseas trips, we attend trade exhibitions, and we engage with other suppliers. So we are always at a time that we can source for new suppliers. What MAPS can do is to help companies who are locked in contracts of supply with the government. Some companies who entered into supply contracts with the government are bound by prices committed about 3 years ago based on local currency. But the suppliers usually denominate the products in US dollars. So we are in a situation that the foreign exchange has recovered significantly, but it is still quite weak compared to years ago. Adding in the increased cost of freight, the prices become untenable for our local suppliers for prices locked in 3 years ago. There are also penalties imposed for failure to supply, as I've mentioned, when the containers are in short supply, the shipments don't come as on time. So all this quickly adds up to threaten the viability of local suppliers, many of whom are our members. The association has several months ago recognized this and have written to the government for leniency and a provision to revise the supply prices. We understand the government does not just apply it across the board and will look at the merits of each supplier in granting any relief. It is also very important to emphasize that the pharmaceutical supply has both a social and business aspect. We are here to ensure that society's health needs are met, but we need to be able to do that in a business-friendly way. At the height of the pandemic, society and government were clamoring for vaccines. The vaccine developments were expedited to meet this challenge, but then the overhang, as we realize it now, has happened. Just this week, a huge pharmaceutical supplier in Malaysia had to take over RM500 million in impairments due to the impending issue of COVID vaccine expiry. The company stockpiled vaccines to support the vaccination program, but in the end, there were just too few takers of the booster doses. So this is where it is very difficult. We know that we have an obligation to the society, but at the same time, there's a business aspect. So these are some of the challenges.
Appreciate that. Now, let's talk about something which is on the back of people's mind. Let's talk about pricing of pharmaceutical products. Currently, what measures are there in place to ensure medication remains affordable to the masses? And in case of an emergency, like a global outbreak, what happens?
Okay, this is actually one of my favorite topics when it comes to pricing, because this is where we have to be very fair to both the consumers as well as the businesses. As alluded to earlier in introducing MAPS, members of MAPS' reason for being, our raison d'etre, is to make medicines affordable. That's why we are looking at sourcing from all over the world. We're looking at generics. 87% of Malaysians pay out of pocket or through some other form of payment schemes, be it insurance, be it employers, and so on. Malaysian government provides virtually free medicines, but there are difficulties due to long queues. There are plans in place to do decongestion at the hospitals. However, although they may be free to patients, they are by no means cheap for the government. You pay RM1 and you get RM20 worth of drugs, not counting the consultation fees. Realizing the need for medicines to be affordable to the masses, a medicine price unit was set up by the government to oversee and monitor medicine price markups. However, we believe that there should be no price controls, as it breeds inefficiency and possibly leading to lower quality products and lack of innovation. An open, vibrant market will ensure a competitive, innovative, and healthy market for the government, patients, and all stakeholders in healthcare. The government should advocate a policy of open market. Just to give an example of how competition trumps price control, let us look at the self-test COVID kits. Initially, when there were only a handful of such kits available, prices were retailing at around RM40 to RM50 per kit. Then the government set the consumer price at RM19.90, so about half, less than half of the prices that consumers were paying. Today, with over 50 kits available, the consumer can get it for 2 ringgit per kit, which is barely 10% of the ceiling price. So actually, the ceiling price is not relevant anymore. The National Medicine Policy, dubbed DUNAS in Malay, has a component on access to medicine, which emphasizes both access to and affordability of medicines. Furthermore, embedded in this policy is a generic medicines policies. MAPS fully supports the policies, and we believe that just by abiding with these policies, medicines can be affordable without having to resort to the mechanism of price control. The government is now adopting a softer stance on price transparency instead of price control. I think the best way to ensure affordability of medicines is to lower barriers of entry for more competition. Malaysia struggles with the liberal granting of intellectual property through patent extensions like patent evergreening, efforts to make a molecule remain exclusive even when there is lack of innovative and inventive steps. We respect the right for true innovation and innovative medicines to be given a period of exclusivity, but not beyond that. Putting an end to easy granting of IP would lead to a thriving generics market, which is good in keeping the medical bill low. MAPS members are ever willing to introduce more affordable generics. We are only constrained by IP protections beyond what is a reasonable period. This is also where government intervention is required. The government can invoke the right to compulsory licensing based on provisions of World Trade Organization. For example, with the issuance of a compulsory license to sofosbuvir, which is a direct-acting antiviral, the price was brought down to less than $300 per course of sofosbuvir and another antiviral, daclatasvir, for treatment of hepatitis C in Malaysia. Malaysia has over 400,000 people suffering from HCV infections. That is a saving of nearly US $83,700 per patient. If we do the math, we can see that this is one massive savings for Malaysia and a major move in making medications affordable. These savings can be plowed back to other programs, example, patient education, screening, as well as in preventive measures. Successful control of HCV also has its cost saving on the healthcare sector, as the cost of managing the sequelae of HCV is very high. For example, liver cancer. Cancer drugs are not cheap. And on top of that, the loss of productivity of the patient, even if the patient survives, the number of days that he has to go on recuperative leave is lost. Another way to make medicines affordable is to educate the consumers on their right to choose their source of supply. There's a case of what we call captive market, where once a patient seeks a treatment there, they have an obligation to buy it from where they are seeking treatment. But it's not necessarily the case. So they can choose to supply from somewhere else. A study was done in Malaysia, and this was published 5 years ago. It established that there are significant differences in consumer prices. So you are a patient, if you're buying it from a hospital or you're buying it from a retail pharmacy, right? So what was found in the study was that the community pharmacies supply the same product at much lower prices. MAPS members are strongly in favor of pushing for generic substitution and entry of biosimilars at the soonest possible time. Everything mentioned earlier in this segment, that is open market, multiple sources, strict granting of IP, are pertinent in handling the global outbreak.
Right. Thank you so much for that. Now, we do understand the importance of taking up a membership with you because of trade representation. Now, how can suppliers and distributors reach out to you to sign up for a membership? Do they just go to your website and click on membership? Is it that easy?
Thank you, Francis. Thank you very much for opening up this subject. We are still a relatively small association, but we can play a bigger role. most importantly is whoever is interested can visit our website. I think if you look towards
your right, I can see it there.
My right, that's the website. Okay, they can go to a website. They can contact our secretariat. They can email us or they can visit us. Our website is the best way as an initial way of reaching us. Even our address is listed on my background. So worldwideweb.imaps.my, and our contact details are found in Contact Us tab. So you go to our website, there's a tab which you can use to contact us, and all the links are there. Okay, there are links available to check who are our members and to look at our code of conduct that they have to abide by. We don't just accept anyone to be our members. They have to have a certain level of conduct to make sure that they represent us in a responsible manner. And even to download our membership application form. So there's a link, as you were saying. And then we welcome any company involved in the importation and supply of medicines in Malaysia, with specifically a portfolio of generic affordable medicines and biosimilars. Thank you.
Thank you so much. Now, do you have any final words to share with the global business community?
Thank you. This is the most important part. Malaysia is an attractive market for business opportunities with a government that is committed to industry-friendly policies, and in some cases, there are even incentives for startups. It is also a low operation cost within Southeast Asia. It makes us a very attractive destination. Furthermore, as I mentioned about the local currency, it is currently quite weak against major currencies like the US dollar. And this makes initial investments a very low entry barrier. The labor force is adequately knowledgeable. We are churning out about 1,000 pharmacists a year, maybe about 5,000 doctors a year. The labor force is skilled, able to converse in English, since we are a Commonwealth country. Moreover, we are a multiracial society where most of our population are at least bilingual, and some are even trilingual. With a knowledge of Malay language, our population can easily interact with people of Indonesia and Brunei with some minor adaptations. A sizable portion of our population is also fluent in Mandarin and some Chinese dialects like Cantonese, Fujian, and some are ethnically able to speak in Tamil as well. That opens up to interact with the two most populous nations in the world. Malaysia is also strategically located geographically to serve the ASEAN countries and even beyond. As you know, the hub for low-cost carrier, AirAsia, is in Malaysia. There are cheap flights operating out of KLAA to major business destinations. And furthermore, this is to tell you why you need to work with MAPS is MAPS members have the experience, knowledge, resources, and network to help any overseas company wanting to make a market entry into Malaysia. Thank you.
Thank you, Mr. Lim. That was Mr. Lim Teng Chyuan, the president of Malaysian Association of Pharmaceutical Suppliers, also known as MAPS. So, folks, as long as you're in the pharmaceutical trade in Malaysia, do not hesitate. Contact the Malaysian Association Pharmaceutical Suppliers now by clicking the link below. We have it right below this video. Take up a membership to have your trade represented. As always, thank you for watching, and remember to hit that subscribe button and connect with the movers and shakers of the business world. I'm Francis Michael. I'll see you soon on The Chamber Guy.